So, I recently posted on Facebook regarding heroin and opiate addiction, and it generated quite a response and quite a bit of discussion. So, here are my thoughts on the matter. Um, is it the doctor's fault? Is it the fault of the medical establishment? I think not entirely, but as physicians and healthcare providers, and as a society who has come to expect this zero tolerance for any pain whatsoever, I think, yeah, we have a part to play in things. Do I think it's the root of the problems? No, absolutely not. I don't think that the reason people are addicted to heroin and to opiates in general are because the doctors are prescribing all these pills. I don't think that's true. Um, there are situations, and unfortunately in the past, I think most of my partners have caved to this from time to time, that we are responsible for patient satisfaction these days, and we want people to be happy. And if it means giving someone 6 pain pills for a sprained ankle, even though ice and Motrin would probably be fine. I don't do it often these days, but in the past, yeah, I've I've caved into that pressure. So I think we have to own part of the problem, but I think it's very clear from the science and from if you actually sit down and talk to these people as humans, you don't push them away because they make you uncomfortable. And I know there are exceptions to the rule, but I think the vast majority of these people, when you talk to them, the heroin addicts, the opiate addicts, um, a lot of addiction in general, actually, that most of these people had pretty awful, horrible childhood. Um, from the science that's around these days, I think it's clear if you do any sort of literature search that these traumatic childhood experiences, whether it be physical or sexual abuse or even neglect, um, that it changes the way your brain is wired. And if my happiness level is 100, these folks, they live at level 50. So when they use these drugs, when they use these substances, for the first time ever, they feel normal. I don't think they're seeking a high. I think they're trying to feel like a normal person. And then asking somebody with that sort of dysfunction to go back to living a miserable life that's filled with chronic pain when they know that they're just one score away from feeling normal again, I think that existence would be excruciating. So I think until we figure that problem out, until we face the problem head on of that, yeah, there's individuals in our society that have horrible childhoods, they have traumatic experiences, and they are just wired differently. Until we acknowledge that, I don't think this epidemic is going to go away, because the demand for these substances is not going to go away. And the war on drugs, I think, certainly is not the answer. I think it's been a failure on more levels than one. I think it's been less than helpful. I think it's been harmful. When you take an addict and you throw them in a jail cell with other addicts and criminals, it doesn't help the matter at all. It breaks up families. It costs millions of dollars, maybe billions to taxpayers, fills up our jails, lets violent criminals go free. So, no, I don't think the war on drugs is the answer, and I don't think throwing more people in jail and more stringent anti-drug laws, I don't think those will really make a difference. I think owning the problem and realizing that we have a core disconnectedness in our society today that wasn't present years and years ago. We spend so much time on Facebook. We text instead of making a phone call to our mom. We message a friend on Facebook rather than asking them about their new baby. Our communities, especially in the inner city, vast majority of people are growing up in single parent households. That means that person has to work. If they don't have to work, they're living in poverty. Divorce rates well over 50%, I think, these days. So until we figure out this problem of values and connectiveness and that sort of thing, the narcotic, this epidemic, I don't think is going away. So I know many of you don't agree with all these things, but let's keep the discussion going. I think it's super important not to look away and to talk about these things. And if we have someone in our life that's being affected by this, that we confront the problem head on and don't let it fester. So thanks for watching. Again, comment below, share if you want. I think it's really important to keep this conversation going. So thanks a lot. Bye.